Welcome to Hounslow Carers Week from the Positive Behaviour Support Team. Positive behavior support is a scientific approach to behavior. Behavior is everything that we can do that a dead person can't. So everything we do is behavior. Talking to ourselves, smiling, even voting is behavior. There are many examples of positive behavior support. Teaching carers to recognize triggers to reduce the frequency with which a person slams doors. Increasing the likelihood that someone will take their medication by making changes to their routine. Teaching someone self-management strategies to reduce their intake of sugar. Positive behavior support focuses on the interaction between a person and their environment. It is based on successful research, and it puts their person, their needs, and their wants at the center of everything that we do. PBS is based on the best available research. Many studies have shown that PBS reduces challenging behavior. Challenging behavior is any behavior that puts the person and others at risk of harm. It limits community access and participation, and it undermines a person's rights, dignity, and their quality of life.
There are many behaviors which can be perceived as being challenging. Most frequently, it is aggression towards others, but there is a number of things such as absconding, inappropriate sexual behavior, disruptive behavior, stealing. All of these behaviors can be problematic, but they can also be changed.
PBS intervention would firstly focus on why behavior occurs, and then we will make a plan that fits our client and his parents and carers. The common goal of PBS interventions is to reduce challenging behavior while increasing quality of life. The PBS team is composed of 3 practitioners, and it is part of the Learning Disabilities Health team. When you make a referral to our team, first, we will decide if we can help. If we can, we will get to know you better, and we might ask you to tell us when behaviors of concern occur. We will design a plan, and we will work with our clients and their parents and carers, teaching them new skills. We will monitor how the new strategies and skills are working, and then we will get together and make decisions of whether to discharge or whether more work can be done in other areas. PBS can be as simple as ABC. First, we'll look at everything that happens before the behavior. How can we know the behavior is about to occur? You probably know that if you smile, people looking at you will smile back. That means you know what triggers their smile, and you know what you can do to make smiling more likely. We also look at what the behavior looks like. We will look at the duration of the behavior, its intensity, and its frequency. And we will look at the consequences. What happens after the behavior takes place? When we behave, one of the things can happen. We'll avoid something or we'll get something. Knowing what the consequence of the behavior is means that we can shape it to make it into something more appropriate while still giving people the things that they want. We will provide two types of strategies. Those that look at what you can do so behavior doesn't occur, and those that tell you what you can do when behavior occurs to make it less likely to occur in the future. It is important to let you know that changing how somebody else behaves will often involve changing how you behave as well, and you have to be willing to do this for the interventions to work. The person you support is at the center of everything we do. Their needs are our primary concern. How much they participate in the intervention will depend on their ability, their wishes, and their circumstances. There is a lot of scope for parents and carers to participate in PBS interventions. You are likely to collect information about how frequently behavior occurs. You might attend training sessions. You will use the strategies and tell us how they're working out. And you may help us make decisions about when to discharge and when goals have been achieved. So who can make a referral to our team? Families and care providers, GPs, adult social care, and other services involved with the client can make referrals. You can get more information in the number you see there or by going on our website. We'll be happy to hear from you. That is all from our team. Thanks for listening and enjoy Carers Week.